say. Let me ask you guys this question. I want to switch up the topics a little bit because I get asked this question quite a bit about COVID and sports risk. So what I'm going to do is I'm going to say the sport, and then I want you guys to chime in on what is the risk. We know the CDC has put out some guidelines out there where they kind of categorize risk as far as low, medium, high, things like that, intermediate kind of thing. So I'm going to say the sport, and then I want you guys to say, what do you think the risk is for COVID exposure? Just a general thing on that. All right, so here we go. Dr. Tokish, I'm going to say the first sport for you. All right, competitive swimming. What's your take on that? Risk or no risk, or high risk, low risk?
Yeah, I think the risk is there. It's not contact, so that's good. But you have to think, if you're training, are you training in the same shower area? Are you using the same pool as the next person? Are you using the same soap? We talked a little bit about the Coyotes preparations. You can't even have community soap anymore. We got to bring in individual little bottles so nobody touches anything. So swimming, I would say, is a little bit of a less risky sport than some of the others, say contact sports. But it's not necessarily always just the activity. It's how they get in the pool, how they're transported, who's feeding them, are they eating the same things? All those other things have to come into play.
Excellent. Here we go. I got this one for you, Dr. Schmitz. Here's the next one. Wrestling. What's your take on risk there?
I think wrestling is the highest risk for any disease transmission. I know JT's taking care of wrestlers when he was at the Air Force Academy, but that is as much contact as you can get, and they're sharing everything. So that's a high risk.
All right, here we go. The next one here, Dr. Tokish. Here we go. Risk in gymnastics.
Yeah, I'm glad you gave him wrestling. So gymnastics, right? The challenge is that you've got the same equipment and the same apparatus that both men and women are using. So the mats, the pommel horse, the rings, the bars, all those are constantly used for reps, just not only in competition, but in practice as well. So I would put that at a medium risk. And really, it's going to be one of those where you're going to have to do really, really aggressive sanitation between each time and each routine that somebody comes through. And then obviously, depending on what the team is doing, are they living together, et cetera, and all the social distancing that goes along with that.
Wonderful. And I have to say, full disclosure, I have an 8-year-old daughter who is a competitive gymnast. They just started back up June 1st. And it's very interesting talking with her and seeing what her gym has laid out. But it's very interesting. But we've had to make that decision, and certainly people out there have to make the decisions for their children to see if they want to still compete. But right now, the Gomez household has said yes on gymnastics, but they're in a very small cohort, and we're stressing sanitation. Here we go. Next one here. Dr. Schmitz. Here we go. Baseball. What's your take? Risk.
I think at the youth level, baseball is a moderate. I think as you get to the pros, it becomes a little bit moderate to high. And again, because it depends on who's using their own equipment versus someone else's equipment. I talked to someone in Denver yesterday who says that they're starting youth baseball, and really the only change is there's no high fives at the end of the game. I'm not sure that eliminates all the risk, but you got to make sure that the kids are using only their own equipment, not sharing bats, not sharing mitts and things like that. But I think that's probably a moderate risk.
You remember when we were kids, Matty? They'd have 2 batting helmets for the whole team, and one guy gets lice. One guy gets lice, the whole team got lice, right? So share a batting helmet, get COVID. It's going to be tricky.
We shared everything. I remember those days. I played high school baseball, at least my freshman year. Then I chose marching band after that. There you go, everybody. That's Dr. G secret. But yes, that's so true. Here we go, Dr. Tokish. I like this one. Cross country. What's the risk there? Cross country. What's your take on that?
Yeah, I mean, of all the sports, maybe running is one that you can be a little bit social distance. They do, unfortunately, start in packs. So I know there's been some suggestion with the AIA here in Arizona, the Interscholastic Association, about doing cross country if they do it in staggering starts so that they keep social distancing at the beginning, right? And then once you're off, there's no congregating. You're off the course and you're gone. And so it's almost like a time trial in the Tour de France as opposed to being in a peloton.
All right. Thank you, Dr. Tokish. We'll do a couple more of these. Dr. Schmitz, soccer. What's your take on that risk?
I think soccer is a moderate. It's not a contact sport, but it's a lot of close contact. And so I think that's a moderate risk. In full disclosure, my daughter is back to playing competitive soccer. They started off with 6-foot squares and individualized training, and they've kind of ramped up over the past couple of weeks, and now they're going to back it back down because of the cases here. So I think that we're seeing that was one of the first sports to reopen in Europe. So I think that there is potential risk there, but not as much as your higher contact sports like wrestling and football.
All right, we'll do a couple more of these. Dr. Tokish, what's your take on tennis? What's the risk there, you think, for COVID-19?
Yeah, I was actually going to say, I think women's soccer is contact. Men's soccer is so much flopping. I'm not sure that's a contact sport. But I think
it's a red card for flopping.
Listen, the women are tough, but and they have a lot of contact. Tennis, as long as you're playing an individual sport on other sides, I mean, that may be the safest of all of them, especially if you're playing outdoors, right? So indoor tennis, and if you're playing on the same team, and again, sharing equipment. But if you're going to do a sport during this COVID time, tennis ain't bad. And in Arizona, pickleball is a religion here. So pickleball is another way that people, especially folks that are a little more seasoned in their age, can get out and play. And it's a great way to sort of get outside, breathe some fresh air, and stay socially distant.
Excellent. We'll do two more of these. Dr. Schmitz, here's the sport. Competitive dance. What's your take on that? What's the risk looking like?
I'm going to have to put that one as low. I don't have any real experience with competitive dance, but I think you can appropriately social distance there as long as your choreographer is setting them up 6 feet apart and they're not sharing any equipment. So I'd put that one at low risk.
All right. I think I put that at low risk too. So I like that one, but I don't have much experience in that one, at least advising patients. Here we go. Dr. Tokish will give you the last sport. Here we go. Competitive cheerleading.
Yeah, I think actually that's high risk for lots of reasons. Cheerleading is not like when we were kids where you had, 6 people standing and waving pom-poms and stuff. These kids are ridiculously good athletes, right? And the formations that they build and the flyers that they do, it's almost like team full contact gymnastics at times, right? So you're building pyramids and you've got flyers and you've got stunt routines. There is a ton of contact there. So that one's a high risk.
Excellent. Well, there you guys go. Nice COVID in sports. Let's get to the next session here. I'm having a great time with both